name is Michelle. I'm a student nurse. Today I'm going to be performing the physical assessment skills. So before I enter the patient's room, I'm going to make sure that I've done my hand washing technique. I'm going to introduce myself to the patient. Mr. Jones, my name is Michelle. I'm going to be your nurse today. What I need to do is give you a physical assessment. Are you okay with that? Should take about 10 minutes. Once I get his answer, I'm assessing for, is there any signs of pain or grimace anywhere? I'm assessing his level of consciousness. I am also looking to see how his speech is, if he understands. Mr. Jones, can you tell me your name? Do you know why you're here? Can you tell me your date of birth? And do you know what year it is? Okay, so I would base my assessment on what his answers are. Also, Mr. Jones, I need to check your armband. Is that okay? I'm going to verify that he is who the paperwork says he is. All right, Mr. Jones, what I'm going to do is I'm going to start at the top of your head. So what I'm looking for is I'm looking for skin color. I'm also checking temperature. I am looking for the symmetrical lines, making sure there's even distribution of hair. I'm going to assess the ears and the earlobe, looking for any lesions or drainage anywhere. I'm going to check pupil size. Okay, I'm looking for the pupils if they're reactive to light. If they're equal, I'm looking at the whites of the eyes. I'm looking at the color. Is there any discoloration to it? I'm also going to be checking the nose. I'm looking for symmetry in the nose. Is there any nasal septum deviation anywhere? Looking for any drainage. And then I'd also take my pen light and I'm going to inspect in the mouth. I'm checking the hard and soft palate, looking for any lesions or drainage. Looking to see if there's any assisted devices, if he has any dentures. I am also looking to see if he has any missing teeth or loose teeth. I'm checking the tongue. Everything seems to be okay here. Also with the ears, I would be looking for any assisted devices, if he has any hearing aids, as well as the eyes if he wears contacts or glasses. Okay, then next I'm going to work my way down to the chest. And here on the chest, I'm inspecting to see if there's any abdominal or diaphragm breathing. I'm looking to see that the chest rises and falls equally. Looking to make sure that there's no rapid breathing or slow breathing, that it's a regular steady pace. Again, I'm looking for any edema anywhere. Okay, I'm checking for skin temperature. And also with inspection in the mouth, I would be looking at the gingiva to see if there's any edema or any bleeding anywhere. Okay. I'm going to auscultate for the 6 points on the chest. Then I'm going to find the apical pulse, and I will do an apical pulse check for 1 minute. Okay, Mr. Jones, while I have you sitting up like this, I'm going to sit you up a little bit further and I'm going to listen to your back, okay? I'm going to lift you up. 1, 2, 3. With the back, I'm going to be listening to the 10 points in the back. Very good. Also, while I have him sitting up, I'm going to be looking at skin coloration and the integrity of the skin, looking for any redness, any skin breakdown. I'm checking the spine to make sure that there's no deformities anywhere. Everything looks okay. Mr. Jones, I'm going to go ahead and lay you back down. Okay, then next with the arms, with the top here, I would also check carotid pulses one at a time. Okay. Coming down the arms, I'm going to check for radial pulses. Brachial pulses. Mr. Jones, can you squeeze my hands for me? Okay, I'm looking to see if he can follow instructions, if he has any strength in his hands. I'm also looking for any contractures or anything anywhere on the hands. I'm going to check capillary refill on both hands. Next, I'm working my way down to the abdomen. First thing I'm going to do is I'm going to inspect, and I'm looking for any distension. I am, again, looking to make sure that there's no discoloration anywhere. Okay, Mr. Jones, I'm going to listen to your bowel sounds, okay? Be listening on 4 points. Once I've heard bowel sounds, then I'll go ahead with my palpation. Okay. And while I'm doing this, I'm looking to see if there's any signs of pain or grimace or anything like that, making sure that everything is good. All right. Mr. Jones, can you tell me, have you had any recent coughs? Have you had any sputum? If you have, I would ask what color it was, the amount. I would also ask him if he's been able to urinate properly, if he's had any trouble with that. I would ask when his last bowel movement was, and if it was a female patient, I would ask her when her last menstrual period was. All right, next I'm working down to the legs. And at this point here, I could check for femoral pulses. Okay. And then with the legs, again, I'm looking for any signs of edema. I'm looking at the color. I'm making sure that there's no bruising anywhere, that there's no skin breakdown. So what I'm going to do is make sure that everything is good there. Check the back of the heels, behind the knee. I would also be checking the Holman's technique, and I'm also checking the dorsiflexion. Okay, Mr. Jones, does that hurt at all? Okay, and of course I would adjust my assessment based on if he was experiencing any pain. And I would do this on both sides. Okay. All right, next I'm going to check the pulses. So here I'm looking for the pedial pulse. I'm also checking for the posttibial pulse. And then I'm also checking for the popliteal pulse. At this point, Mr. Jones, I'm going to go ahead and roll you over on your side, okay? You need to just take a look at your back and your bottom. So I would raise the bed to a good working height. Okay. Well, this bed doesn't work, so what I would do is I'd raise the bed a little bit, keeping this bed rail down, make sure that one is up, and then I would have him turn to his side. And then while here I'm inspecting the buttocks area, again looking for any redness or skin breakdown, any drainage anywhere, any edema. Okay, everything looks good on there. Okay. All right, Mr. Jones, well, that concludes our physical assessment. Again, my name is Michelle. If you need anything, just let me know. Your call bell is right here, and I'll be in to check on you in just a little bit, okay? Then I would complete hand hygiene and document. Thank you.